CO2 for the rolling stars that we had discussed earlier. I love this laser. It's so fun to see it fired. It's like a scanner. You can kind of zoom in on it. So some pinpoint bleeding is normal with this. It is one of the deepest resurfacings that we have. So great for acne scarring, great for resurfacing for deep lines and wrinkles.
So for everyone tuning in right now, Reve, what are we doing again?
So for everybody tuning in, we just started doing our CO2. This is a resurfacing we are doing for acne scarring. This is actually his second treatment. How long ago was your first one, Michael?
It was last April.
Okay, so it's been a little while. Since then, we've done a series of microneedling treatments to try to improve the scars. He had a lot more, I would say, defined scars before this. Now they're not as defined. Now it's more of the rolling. So we just did a TCA for those that were tuned in a little bit earlier. TCA is a chemical that we use to treat ice pick scars. They form a bit of a scab, and that scab heals and it actually fills in the space inside of the acne scar. Downtime for this will vary, but at least 7 to 10 days, depending on how aggressive the treatment goes. We did a nerve block on him, so you guys can see that he's not in a lot of pain. This is a pretty extensive treatment, but with the nerve blocks, it really increases patient comfort. So you can see his skin is oozing. We have broken that skin barrier that keeps the fluids in. Michael, how are you doing?
Did you remove the TCA before the CO2?
You do not. You leave the TC on the skin. So you treat that first.
So you keep it on, guys.
So we keep it on. So you can see right here, for those that are tuning in, this is where we did our TCA. That is the clinical endpoint. We want a nice frosting. We're gonna go over it with the CO2 because we're not, right now we're treating a little bit more of the surface of the skin. Do we have any questions?
Let's find out. Shooting him out there.
Don't go close to my ear, because I can feel it. Like,
Right here?
yeah, don't go like to the edge.
Have you move your face over like that? Like I said, he can expect about at least 7 down days. The skin will be resurfaced in that point, but it will be nice and red and dry, so he'll still be using all of his creams. Dr. Emer has a strict post-procedure protocol that he uses so we can heal faster and heal appropriately without any, or decreasing the potential of any side effects.
So we got a couple questions.
Yes.
Can you explain why CO2 is preferable to erbium or other lasers to this candidate?
So erbium is a little bit different. Cool laser, one of the reasons I love it is because we can do a combination of fractional and ablative. Just like Fraxel, erbium, like I said, it can be fractional. So instead of treating all of the tissue, you can see here, we're not leaving any healthy tissue in between. So this is ablative. Ablative isn't appropriate for every skin type. Not every skin type is a candidate for that. And also depending on what we're treating. And the skin type. For me, I love doing Fraxels twice a year to help resurface, and I also love doing erbiums. What's great about the erbium, or also known as the cool laser, is we can treat fractionated around the entire skin but then maybe people have lip lines they don't like, or they have, you know, wrinkles around their eyes we don't like. We're able to change that laser to do ablative in those areas, treating the rest of it fractionated. So we're really able to cater those treatments depending on what we're trying to treat. Fractionated is going to be safer in darker skin types than ablative would be.
Okay, that stop right there. Just don't go too close to the eye.
And how long does it, does it work on hypertrophic scars?
You know, hypertrophic scars, depending on what they're being caused from, if it is a keloid, thickened scar, we always have the potential to do that. So usually we treat it with steroids. We can also treat it with microneedling. But, you know, anything that you do, if you have a history of that, you can always get hypertrophic scars or keloids.
Good right there.
So for those just tuning in, we are doing a CO2 laser to remodel for acne scarring. Our patient is doing great.
And can it work on Asian skin types?
You know, it depends. I also feel like depending on what we're treating, if it's acne scarring, sometimes we know we're gonna cause a post-inflammatory hyperpigment, and then we kind of deal with it. So we have to figure out what's worse. Is it the acne scarring that's really bothering you? Is it the pigmentation that's bothering you? So kind of what we're treating. I wouldn't say no, but I also wouldn't say yes, because there's a lot of different skin types with Asians, and they could be very, very light, and they can also be a lot darker. So that's something you would really want to come in and get a consult, so we were tending to your skin and providing the best possible combination treatment for you. But as a blanket, you know, it would just depend.
Awesome. And we're good, Rebe.
All right, you guys, so we're gonna go ahead and finish this treatment. If you have any questions, you can give us a call, but thanks for tuning in.